dressing is a dressing that is particularly designed for a drainage tube management. It is a product of our own development and is patented with its innovative design. Most common tube types that cath dressing is used for are such tubes as JP, Hemobag, and CVC. The product can be used for various sizes of catheters, ranged from 8 French to 26 French. 1. The polyurethane foam is known as a hydrophilic pad, which absorbs the ooze immediately. This keeps the environment that inhibits potential bacterial growth, but promotes faster healing of the area. 2. The polyurethane foam is attached to the adhesive surface, which means no extra dressings or tapings are required. The adhesive surface is skin-friendly, while providing a strong fixation at the same time. This one-touch application makes the whole procedure much easier and faster. 3. The 7 cuttings in the middle and a side cut lessen extra work, such as a scissoring of the gauze, while allowing a broad application of the product around different sized catheters. Cath dressing is sterilized with an EO gas and the product is individually packed. Conventional Y-gauze dressing. This shows a common procedure of a conventional Y-gauze dressing. The gauze must be cut in a Y shape in order to be placed around the tube. Place the Y gauze around the catheter. Second dressing is done with a 4-inch dry sterile gauze on top in order to cover the Y gauze. The gauze is then secured by tapes. This method requires several steps, and the gauze may not be completely sealed. Therefore, there is a risk of infection and/or contamination during or after the dressing procedure. Also, the tube remains folded, and the flow of the fluid may be inefficient. How to use cath dressing. This shows the application of cath dressing poly-O type. Unpack the product. Remove the film. Place the dressing around the tube by positioning the tube in the middle of the dressing. Remove the remaining films. Attach the surface to the right position around the tube and press gently to finish sealing. This method reduces the risk of infection due to the complete sealing and minimal step required. This also saves a lot of procedure time. Cath dressing poly-O 10 centimeters. The polyurethane foam is known as a hydrophilic pad, which absorbs the ooze immediately. The polyurethane foam of 10 centimeters, 3 inches, can absorb up to 20 cc of the ooze, while smaller size of 7.5 centimeters, 3 inches, can absorb 12 cc of the ooze. The amount of absorbed ooze is visible from outside through the dressing, and the users can easily check when the replacement is required. Since the catheter dressing is one of the most basic and common procedures after any surgical process, the fields of application is broad. Major departments where cath dressing is used include radiology, general surgery, gastroenterology, orthopedics, urology, ICU, wards, etc. Cath dressing indeed provides a high-quality, easier, faster, and safer dressing method to doctors, nurses, and patients.